Hello everyone, welcome back to my YouTube video channel. I want to test this first lecture using the screen here. And you can see that this is a beautiful case, and I want to discuss about how you go about this case. Um, anyway, first one, a patient came in with a broken tooth like this, the evolved tooth missing now. What are you going to do about it? How you approach this one? And so another picture, the zoom in that you can see is the patient have pretty much really tissue damage there. The tooth here, number 9, a lot longer than the other tooth on, so it's extruded. So what the plan? What you gonna approach? So here's another picture of the inside your mouth. So came in. This happened about 10 days after the tooth evolution. Couldn't find a dentist that can take care of this case. So those are picture, say 1,000 words is missing those tip here. What your approach for this case? Um, here's another intraoral photo that show missing tooth on number 5, number 3, number uh, 12, 13, number 8, a lot of missing tooth there. So what are you planning to do in this particular case? I discussed with her all options. We can put all the implant wherever it's missing. She doesn't have money, so you can just only able to afford replacing the front tooth. So right away I told her that you need to give me your evolved tooth so I'd see what I can do. So here what happened, we packed the bone inside, really pack it, number up, pack the bone in, and try to place the implant on the same day. And this is how the healing abutment looked like. Okay, same day visiting, place the implant and clean up everything. Uh, so as you can see, beautiful tissue look a lot more healthy as you secure the healing abutment with this one. And this is what I do. Her evolved tooth number 8, I cut it in half and I clean out inside here, and trying to reline this tooth so I can use it as a temporary crown and mold the gum. So the idea is to mold the gum. So let's take a look. Here we go. What I did was I not only try to give the patient a temporary crown, but also as you can see this wire here, I use a night tie wire and try to pull the number 9 inward. So because the number 9 would extrude it, so we're trying to do it, pull it inward by bending the wire toward the incisor and allow the night tie wire to have a memory to go back to original shape, would push the tooth number 9 inward a little bit. So that's the whole, this is right on the first day of visiting. So patient came, yeah, as soon as I put in, I take some photo and show you how it looked. And this is how the x-ray it looked like. Okay, implant going in, healer abutment going, and then a temporary crown on top of that. And here's the video. I just want to show you the progress of the video.
Hello guys, welcome back to my YouTube channel again. Today is very interesting, the immediate implant placement of a tooth evolution. Actually this tooth have came out about 2 weeks already after the Mother Day. The accident happened during the swimming pool. This patient have tooth number 8 the extra oral because this is HIPAA compliant. So we're going to focus on the implant, how we do this. I'm going to graft it. The idea is to preserve the bone. I have for this
This is how I show you guys how to align the internal part of the temporary crown using the permanent tooth. So we have to do step-by-step designing the tooth. On my YouTube video on how to handle tooth erosion after time. It's got the title. And so, that's it. That's it to begin with.
You daily, weekly, monthly.
Closes,
Please
and then
subscribe to my
we'll do
channel
another
and check out more
video.
video down
This
below.
is another video. As you can see here, the progress from beginning to a few months later, how the gum is really molded to get ready for permanent crown, and you can see it beautifully looking. Want to show you the final case smile. Okay.
Hello everyone, welcome back to my YouTube video. Go ahead and clean out the granulation tissue, internal part of the gold into digital impression, so there's no things to worry. As you can see, I put the Teflon underneath that, so I'm hoping the collar will be whiter. As you can see right now, the collar is actually margin is just right at about half millimeter. Doesn't use the water
The final
part. I reline with the flowable water, the zirconia. Right.
Hey guys, thank you for watching. Hope you like the video. Any questions, check out my YouTube video
and do me a favor, guys. Subscribe to my channel. Hit the like button and share to everyone. And thank you again for being a subscriber. Have a great day.